During the National Press Symposium, a Maltese consensus paper has been discussed, and we had a big discussion about that, and after that, all the faculties of the meeting agreed on this paper. Malta Health Network, Pain Foundation, and SIP Malta fully endorsed the SIP 2016 recommendation and the societal impact of pain roadmap for action. And starting from those recommendations, we tried to lay out a roadmap that effectively addresses the issues of chronic pain in our society. So we kept in mind 5 factors when drafted the Maltese consensus paper, which are the easy of implementation, cost effectiveness, urgency, national priorities, and major impact for patients. Keeping these 5 key points, we have proposed 9 recommendations. We recommend that chronic pain should be recognized as a disease in its own right and should be included as an independent condition facilitating the access of chronic pain to the treatment and management. A chronic pain prevention campaign should be run to raise awareness about chronic pain. We are proposing that local pain management policies and services within our national hospital should align towards European policies and guidelines. Research to be given more importance. Closer internal ministerial collaboration is important. Pain should be included as a key indicator in the outcomes of medical and surgical interventions. Appropriate facilities should be established to facilitate specialization of health professionals in the field of pain management and treatment. The Maltese authorities should enact and facilitate the vocational retraining and integration into the workforce of persons suffering from chronic pain. Then, a national pain plan should be established and implemented by 2020. So that's what we agreed. And we don't want this consensus paper just remain a piece of paper, but we want that these recommendations are translated in effective action. Now I give the floor to Gertrude, who will give some information about the discussion we had during our meeting.
We had a mix of professionals and patients sharing their views with us. We had Professor Boss Samolski-Dekel, who spoke about the treatment of pain patients can be demanding, and the right of good practice of pain medicine in the current economic and legal social environment can be difficult. The clinician is in a position of understanding that the subjective experience is the objective reality of pain. Dr. Chris Wells stressed on the importance of learning from best practices and working for the welfare of patients. Whilst Dr. Neville Kalea spoke on the importance of research so that there is a justification of the investing more in health. And he mentioned a study which is currently being carried out in collaboration between the No Pain Foundation and the Ministry of Health. Another research which is currently being carried out was presented by Dr. Mario Grishti, and it is entitled The Impact of Pain in Maltese Citizens. Dr. Marilyn Asa, who is a pain specialist running the pain clinic at Mater Dei Hospital, expressed the importance of such a clinic being run by a specialist in health in pain rather than serviced by other specialties. She showed a concern why patients are not being referred to this specialized clinic, such as cancer patients, and also expressed the problem of lack of medicines being available in Malta because suppliers do not consider our country's numbers big enough to be economically viable to supply such medicines. Mr. Matthew Camilleri, who is a physiotherapist, shared with us the importance of therapies for the pain patients, such as physiotherapy as an example, and thus such should be considered by policymakers when making services development. I lost my patients. The patients were obviously enlightened by Pete Moore and his sharing with us the pain self-management program which he has developed and which is stressed that we need to teach professionals so that they will be in a position to recommend self-management to their patients. Mariano Votta from ACN shared the concept of having a pan-European Mediterranean coalition which brings together the initiatives which ACN has been collecting over the past 2 years, but now there is the ideas from just a collection of practices to take on a more collaborative approach. Patients expressed their views via a video which we realized in collaboration with organizations and patients, where they shared the burden which pain plays on their everyday lives, but also some of them shared with us the positive experiences which came to their lives, although they are experiencing chronic pain. As in conclusion, with the contribution of the experts panel, which included Job von Grievensen, Chris Wells, Nicola Bedlington, and William Raffarelli, the discussion looked at how the proposed consensus paper fitted with the European level. The session was concluded by another panel, which included Reverend Father Chris Canwara and Ms. Antoinette Calleja. There was a general agreement that the proposed consensus paper can be achievable and is doable, given the goodwill of all involved. The paper seeks to drive policy by applying knowledge, skills, and human sensibility in the pain professionals, stimulate more collaboration with the pain patient, applying the most technically right and morally sound actions to regain personal dignity. Thank you very much.
Thank you.